Hello, everyone. My name is Jaydira Del Rivero. I am a medical oncologist and an endocrinologist at the National Cancer Institute at the National Institute of Health. Today, we're going to discuss about what's new in clinical trials. What are clinical trials? Clinical trials are research studies that test how well new medical approaches work in people. Also, clinical trials is also help me to understand the efficacy of certain drugs. Clinical trials is not only treatment trials, but it's also a natural history study as well. It's also considered a clinical trial. Clinical trials also help me to understand as well any quality of life of patients, any prevention studies as well. Those are all considered clinical trials. Due to the sake of time, I will not be able to discuss the different phases of clinical trials. It's important for you to understand what are the important questions to ask in clinical trials, but there is a lot of information at the Net Research Foundation that I will encourage you to also look into that. There are different links here that you're able to see, so that way you're able to go there and understand what is are clinical trials, the different phases, and what is important to know about clinical trials. In terms of the treatment landscape of neuroendocrine tumors, before 2000, there were no other treatment options available for neuroendocrine tumors. But now we can see that in the last 2 decades, there has been different treatment options available for neuroendocrine tumors. But still, the question remains, when do we need to give a specific therapy? For how long do we need to use the therapy? What type of neuroendocrine tumors may benefit better for certain therapies? And because of that, there is a lot of questions that we need to answer in terms of the better understanding of neuroendocrine tumors. Because of that, at the NIH, at the institute where I'm working, we have a natural history study for neuroendocrine tumors. I'm very fortunate to be leading this study, leading these efforts to understand more about the biology of neuroendocrine tumors. We wanted to characterize the natural history of neuroendocrine tumors. We also wanted to include very detailed information, not only about the clinical characteristics of the neuroendocrine tumors, but as well correlate that with patients' demographics, patterns of disease progression. We wanted to understand what neuroendocrine tumors may benefit for certain therapies. We also wanted to understand what neuroendocrine tumors may recur earlier compared to others. All of that questions we're hoping to answer with this study. One of the treatment options for neuroendocrine tumors is also surgery. And here at the NCI, I work very closely with my neck surgeon. His name is Jonathan Hernandez. If a patient comes to the NCI for surgery, we collect a small piece of tissue and we send that for research. One of the difficulties about neuroendocrine tumors is that we don't have many preclinical models in order to test different drugs to understand what therapies may be effective for neuroendocrine tumors. And because of that, we're working on developing clinical models. One of the efforts of the Net Research Foundations is that they are also funding a lot of these efforts. And this is an unmet need because without robust preclinical models, we will not be able to develop therapies or better therapies for neuroendocrine tumors or more therapies for neuroendocrine tumors. We also wanted to understand the different genomics of neuroendocrine tumors. And with that, we wanted to also understand whether we can discover any predictive biomarkers, meaning any biomarkers that help me understand which patients may benefit from certain therapies or which patients over time may also have worse disease in terms of the neuroendocrine tumors. We also wanted to understand more about the tumor immune microenvironment. We also wanted to understand that based on the immune microenvironment, what therapies may be more effective based on that. So those are the different questions that we wanted to answer with this study. How you're able to participate in this study or any study within the clinical center is either the patient themselves referred to us or the treating physician referred the patient to us. We collect all the clinical information, we collect all the imaging reports, pathology. We discuss with different members in our team, different specialties within the clinical center. And based on that information and what we review, what we concluded based on our review, we provide our opinion to the patient or the referring physician. If the patient is willing to come to the clinical center for surgery, we have a study to be able to do surgery at the clinical center, and we call that the standard of care protocol. As I discussed earlier, I'm fortunate to lead the natural history study for neuroendocrine tumors, and if you're willing to participate on the study, so that's an option as well. We also have treatment options for neuroendocrine tumors, and if we feel that there is a treatment study that the patient with neuroendocrine tumor may benefit from, then we discuss as options with the patients. So let's discuss some of the treatment studies studies that we have available at the NCI. So this is a study that I'm very excited about. This is a phase 1/2 study. Again, as I said earlier, it's very important that you go to the different resources in the Net Research Foundation to understand about the different phases of the clinical trials. Phase 1 is safety, and also to understand what is the best dose to then move to the phase 2, which helps me understand not only more about safety, but also to understand the efficacy of the drug. So we have this study, which is a 177 lutetium dotatate or Lutathera, and this is in combination with olaparib. Lutathera is a type of radiation, and this type of radiation causes DNA break. And when that happens, your body is going to try to repair that break. And when that happens, sometimes it can make the treatment less effective. So how we can prevent that break is by adding a medication. Another drug is called olaparib. So this olaparib is approved for breast cancer, for ovarian cancer, for prostate cancer. And this medication is in the family of the PARP inhibitors, meaning that it can block the DNA repair. And with that, we wanted to answer whether by adding this medication, could we make PRRT more effective? Because we know that PRRT with Lutathera, 177 lutetium dotatate, we know is effective and is approved for neuroendocrine tumors, but can we make this treatment more effective? And by adding this drug called olaparib, that's one of the questions that we wanted to answer. So as I say, this is a phase 1/2 study because it has not been used in humans before. We wanted to understand the safety of the combination. And then once we know what is a safe drug, then we move to phase 2. The question that we wanted to answer is, number 1, whether the combination is safe, but number 2, whether we can make 177 lutetium dotatate more effective. This is an ongoing study. We're currently seeing patients and we're screening for the study as well. Another study that I would like to mention is also the use of Lutathera in patients with pheochromocytomas and paragangliomas. Pheochromocytomas and paragangliomas is another subset of neuroendocrine tumors, more rare type of neuroendocrine tumors. And this 177 lutetium dotatate, we wanted to also determine how efficacious can be in this tumor type. As I say earlier, 177 lutetium dotatate or Lutathera was approved for neuroendocrine tumors. That was approved in 2018 for pancreas as well now for small bowel neuroendocrine tumors. And we wanted to understand whether the same drug can be effective on patients with pheochromocytomas and paragangliomas. And the reason why we wanted to answer that question is because pheochromocytomas and paragangliomas also express the somatostatin receptors in the surface of the cells. And we see that by doing the scans that I'm sure a lot of you have heard, which is either the 68 gallium dotatate scan or the 64 copper dotatate scan. And as we can see here in this little figure here in the bottom, patients with pheochromocytomas and paragangliomas strongly express this receptor. So the question we wanted to answer by doing the study, if this treatment can be also effective in patients with pheochromocytomas and paragangliomas, we wanted to understand if by giving this therapy, could that stabilize the growth of tumor? Could this treatment can help patients with pheo and para live longer? Could this also shrink the tumor? So those are the different questions that we want to answer with this study. And also very fortunate to work with Dr. Lin, who did the study for patients with pheo para. Similarly, we have another study that I'm also very fortunate to lead with Dr. Perez. This is a study of a chemotherapy drug called temozolomide, and it can be given alone or in combination with olaparib. Very similar to what I explained earlier with 177 lutetium dotatate or Lutathera, which is a type of radiation that breaks the DNA of the cells. Temozolomide, also an oral chemotherapy, causes a break of the DNA. And very similar to what I said earlier, if by adding olaparib, could we make this therapy more effective? And that's one of the questions that we want to answer as well. And this is, as I said earlier, under my study, patients either getting temozolomide alone or getting temozolomide in combination with olaparib. This is a randomized study, meaning that a patient doesn't get to choose. I don't get to choose. The computer is doing the randomization for us, and that's how we are doing this study. This is also a study that is active with accruing patients, and if you have any questions, please don't hesitate to reach out to me anytime. Similarly, we have another study available for pheochromocytomas and paragangliomas. This is lanreotide. So lanreotide is a monthly injection. Some of you are familiar with this drug because it's also given for patients with neuroendocrine tumors. But we also wanted to understand if by giving this monthly injection, could we slow down the growth of tumors related to pheochromocytomas and paragangliomas? Similarly to neuroendocrine tumors, we need to have a positive either 68 gallium dotatate scan or 64 copper dotatate scans in order to be eligible for the study. This is also a study that is led by Dr. Fojo for Columbia University. And we also, as size of the study, we also see in patients at the NCI. Now let's discuss about ongoing clinical trials for neuroendocrine tumors. Since the topic of discussion is what is new in clinical trials, to me, when I see this slide, it gives me a lot of hope because we can see that there is a lot of going about clinical trials for neuroendocrine tumors, not only for different size of neuroendocrine tumors, but also based on grading. And as I said earlier, I do encourage you to also go to the Net Research Foundation website to learn about the different grades of neuroendocrine tumors as well as different sizes of neuroendocrine tumors, because that's also important to understand. As we can see here, we have ongoing clinical trials for pancreas neuroendocrine tumors. There is an ongoing study of patients receiving 177 lutetium dotatate or Lutathera or versus capecitabine temozolomide, and that's for patients with pancreas neuroendocrine tumors, grade 1 to grade 3 well differentiated neuroendocrine tumors. There is a study led by my good friend Dr. Suarez, which is an adjuvant capecitabine temozolomide. And this is a study for patients that has higher grade pancreas neuroendocrine tumors based on the Ki-67. Ki-67 is a proliferation index. It tells me how the cells are able to divide under the microscope. And if patient high-risk pancreas neuroendocrine tumors with a higher Ki-67 or positive lymph node, this is a study that trying to understand that by giving this therapy after surgery, could that help delay any recurrence of the pancreas neuroendocrine tumors? We have different studies as well of a combination of Lutathera as well. Like I discussed earlier, we have the one that is available at the NCI. There is a study of cabozantinib. Cabozantinib is in the family of the tyrosine kinase. This type of drugs blocks the blood vessel supply going into the tumor. This study is led by Dr. Jennifer Chand. This study includes patients with pancreas as well as small intestine and lung neuroendocrine tumors. This is an ongoing study. Some of my patients have asked me about the alpha PRRT. So the alpha PRRT is a different type of PRRT. So we have the beta, which is the 177 lutetium dotatate, and the alpha. Again, I encourage you to go to the Net Research Foundation to understand between the difference between an alpha and beta, but just in summary, alpha is supposed to be more tumor specific, less damage to digesting tissue. This is also an exciting study. We have two of the alpha PRT ongoing. One is the lead of the dotatate study, which includes the gastric and pancreas neuroendocrine tumors, but also other sites of neuroendocrine tumors such as the rectal and lung. We also have the other alpha PRT, which is called the Respio PRT, and that also includes gastric and pancreas neuroendocrine tumors as well. And those are patients that have already, the tumors grew in prior Lutathera. So this is an ongoing study. A lot of sites within the United States has this treatment available. One other study that I want to discuss very briefly is the combination of Lutathera with triapine. This is led by my good friend also Dr. Aman Shahant. As I discussed earlier, this combination treatment with Lutathera, we wanted to understand if we can make Lutathera more effective. And we have other studies as well for higher grade neuroendocrine tumors, as well as this study, which I think is an also very exciting study of Lutathera retreatment. For those patients that benefit from Lutathera, could we retreat again? This is a study that's also led by my friends Dr. Aman Chauhan as well as Dr. Simran Singh. This is something to be in the lookout. This soon is going to be open. So I think this is an important slide for you to take, and if you can take it and print it and take it to your doctors, this is so that way that your doctors knows what trials are available and what works best for you. I understand this is a busy slide, so something to keep in mind is that we have the NCT number, which is an identification number. So you can Google with this number, or you can provide that information to your treating physician. I think it's important that any discussions that you have in terms of clinical trials also need to be discussed with your treating physician as well. This is another slide. So this is some of the studies I mentioned earlier, but what I wanted to mention here is that there are NCI sponsored studies. That means that the drug is provided by the NCI, so your insurance company doesn't has to cover for any of the drugs because it's sponsored by the NCI. We have different studies here also for different areas, different type of neuroendocrine tumors, whether it's pancreas or GI neuroendocrine tumors, as well as lung neuroendocrine tumors. This is an important study for patients that have lung neuroendocrine tumors. We have a study of I-177 mutation dotatiol Lutathera or everolimus. This is an ongoing study. Many centers within the United States has the study opened. But also something that I did not mention earlier, but it's important to know, is about what therapies are available for neuroendocrine carcinoma. It's just a different biology. We have the neuroendocrine tumors are more slow growing, but then we have the neuroendocrine carcinomas, which are more rapidly growing tumors. And I think it's important to know what therapies are available for neuroendocrine carcinomas. And we discussed about pheochromocytomas and paragangliomas. Again, this is a busy slide, but something I encourage you to take a copies and bring it to your doctors to understand what may work best for you. So in terms of the clinical trials at the NCI, if you want to be part of one of the clinical trials at the NCI, so there is information here where you can contact me directly, or you can also contact the referral coordinator to understand what therapies may be best for you. So please always reach out to me or reach out to your treating physician to understand what is available for you. And with that, I would like to thank you for your attention, and I'm looking forward to answer any questions you may have. Thank you so much.